Hello and welcome to today's webinar on pain management and symptom control, especially for hospice patients. So again, my name is Dr. Brian Haas. I'm so glad that you could join me today so that we can talk about this very important topic, especially focused on the end of life. So without being any further ado, let's go ahead and jump on into our presentation today. So pain management and symptom control, of course, is very, very important to our patients, and we want to make sure that we're trying to achieve that to the best of our ability. But before we get into much of the details, let's go ahead and jump into our standard disclaimer, of course. And this presentation is intended for informational and educational purposes only. While I am a licensed physician, I'm not acting in the capacity of a physician for this presentation, and the content provided herein should only be construed or should not be construed as medical advice, diagnosis, or treatment. And you should always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding medical conditions. Never disregard professional medical advice or delay in seeking it because it's something that you may have heard or seen in this presentation. And of course, no doctor-patient relationship is being established through this presentation. Any and all decisions related to medical care should be made in consultation with a licensed medical professional. All right, about Wellspring Healthcare, if you're a new follower to our channel, we really appreciate the opportunity for you to learn from us. At Wellspring Healthcare, we believe in the power of compassion as well as effective communication and empowering education to transform lives. And we're a trusted healthcare provider in the greater Kansas City metro area, and we look forward to reaching out and speaking with you at further detail. So, of course, you can keep in touch with us. You can reach out to our medical assistant, William. If you are a long-term care facility or an assisted living environment or some other type of congregate care setting that's interested in having Wellspring Healthcare come and provide services in your building, please don't hesitate to reach out and contact Brandy, our Chief Operating Officer, at telephone number 816-708-1658. And of course, please check our website out, www.wellspringhealthcare.org. And of course, our partners at Ascend Healthcare, they provide our hospice services, and I'm a medical director with Ascend, and they provide some of the highest quality hospice care in the entire Kansas City metro area and beyond. And we just are so grateful to be able to partner with them. If you have any questions for Ascend, please don't hesitate to reach out to Christina Cole at christina.cole@ascendhealth.com or www.ascendhealth.com. So let's jump into our presentation today on pain management and symptom control for April. So I really liked this graphic of pain and relief and them coming together because, you know, really we can't avoid pain in many respects, and especially at the end of life, we can't avoid pain a lot of the times. But what we want to do is manage that pain to the best of our ability. And so we're going to talk about a couple of ways that we can do that. So pain, first and foremost, we need to define that pain, right? So pain can be physical in nature. It can be emotional in nature. And we need to make sure that we're using multimodal strategies in order to deal with different types of pain, because not all pain is the same. Different types of physical pain may respond to different types of medication. And so we have to pick and choose the right medications in order to effectively alleviate the pain in the best way possible. So physical pain, let's talk about that first. So we have a number of different ways to treat pain. And the most common and what most people that are listening are probably aware of is our non-narcotic pain medications. Now, these are medicines like non-steroidal anti-inflammatory drugs or NSAIDs. These are things like ibuprofen, Aleve, naproxen, Mobic. They're drugs that help to reduce inflammation, and they work down a specific pathway. And so we group them under this umbrella of non-steroidal anti-inflammatory drugs. And then we have medicines like Tylenol or acetaminophen. And acetaminophen, everyone knows Tylenol. It's a good antipyretic or fever reducer, but it also is a pain controlling medication. But both of these medications are over-the-counter medications. And so they're not necessarily as potent in regards to alleviating pain control as some other medications, but they have very important uses in regards to the type of pain. So if you're having inflammatory pain, a lot of the time we talk about this in regards to arthritis or bursitis or anything with an itis on the end of the word, right? So a lot of the times non-steroidal anti-inflammatory drugs are the best drugs in those situations in order to help alleviate the pain, because the pain is inflammatory in nature. So if we reduce the inflammation by using a non-steroidal anti-inflammatory drug, then we can hopefully improve that patient's pain. Now, other things that are non-narcotic are things like lidocaine patches. Now, again, this is not an exhaustive list. It's meant to kind of give us a broad overview of different topics, but sometimes a topical lidocaine patch can be very symptomatic in regards to its relief, to help patients a lot of the times to alleviate pain and suffering by using a lidocaine patch, because it provides that topical numbing solution. Then we have adjuvant medications. So sometimes antidepressants can help with this. So Cymbalta, some people might have heard of Cymbalta. This is an antidepressant medication, and one of its indications, and they even say it in their commercial, is for the depression that hurts. Because we talked about this before, that sometimes we have emotional pain as well, and we're dealing with things that are very hard for us to understand. For instance, our death, right? So if we are a cancer patient that is facing the end of their life, that might be a very difficult thing for a cancer patient to accept or to tolerate or to simply understand. And so that might compound their already physical pain that they're feeling. And so sometimes instituting a antidepressant medication can be very beneficial and very helpful for patients. Now, there's other medications like gabapentin or Lyrica. These are medications that actually work in the nervous system on nerve pathways, and they can be very helpful in regards to minimizing neuropathic pain. So again, identifying the type of pain, where the pain is, what type of pain medication is going to be the best in order to relieve it. So I really like gabapentin and Lyrica as well. Then we have our non-pharmacological interventions. And again, by no means is this an exhaustive list, but sometimes massage can be very helpful. And that's one of the reasons why at Ascend Hospice, we employ our massage therapists, because they can really help to, if someone's strained a muscle, they can help to work that muscle out. They can provide that massage, that stretching, that passive range of motion. We can apply heat or ice to the patient's area of pain to try and help alleviate pain and discomfort that way. A lot of the times, movement in and of itself can be a treatment strategy, because if we hurt, a lot of the times we kind of brace that thing that's hurting, right? So if it's my arm, for instance, I might be bracing my arm a little bit. And when I brace my arm, I'm not going to move it. And so when I start to move that shoulder, initially there might be more pain associated with it. But then as I start to loosen that joint up, it can start to have some alleviation of pain. So a lot of the time, movement can help with that. Sometimes people will pursue acupuncture or meditation or psychological interventions like relaxation techniques or something as complex as cognitive behavioral therapy. So a lot of different non-pharmacological interventions can be applied to helping someone dealing with chronic types of pain. So then let's jump into the next tier, so to speak. So if we have tried some of these previous strategies and we unfortunately are not able to fully alleviate our pain, then we might need to jump into some of our narcotic pain medications. Now, these medications certainly have a lot of risks, and we're going to talk about some of them here in a minute, but we have two main classifications of narcotic pain medication. The first one is our short-acting pain medications, and these are medicines that we might need to take once every 3 to 4 hours. Sometimes patients will only need them every 6 hours or every 8 hours or even every 12 hours, but they do act in a short time frame, and they have a fast on and a fast offset. So these are medications like Norco, Percocet, oxycodone, or oral morphine. And then we have some long-acting pain medications. So if you're a patient that is dealing with maybe pancreatic cancer or cancer that is metastasized to bone, for instance, that pain often will be a chronic, persistent, unrelenting type of pain. And if you have a type of pain like that, my heart absolutely goes out to you. And I want more than anything to try and help to alleviate that pain and suffering for you. And so sometimes what we may end up doing is providing you with a long-acting pain relief. So what a long-acting pain medicine does is it's something that you would take once in the morning and once at night, or it may be a patch that you apply to your right shoulder or your left shoulder, for instance, and you leave it on for 72 hours. And what this does is it is a consistent releasing of pain medication. So it doesn't really go up and down like our short-acting pain medicine does, right? So our short-acting pain medication may it might take your pain medicine from your pain level from up here, and it might drop it down real quickly, right? But then over time, it's going to rise back up. And then we take another one and it drops it back down. And so what long-acting pain medication can do is it can try and just reduce the overall level of pain, right? So we're still going to have some of these episodic flares of pain, but hopefully it can help to reduce it. So if you're consistently scoring your pain on a 1 to 10 scale in the 7, 8, 9, God forbid, 10 range, right? Sometimes a long-acting pain medication might be beneficial for you. And so you can use that long-acting pain medication to maybe bring your overall pain level down to a 5 or a 6, right? And then you can still continue to use the short-acting narcotic medications for that episodic pain, like if you're having a wound being dressed, or if you're needing to try and get up and walk, but you have a compression fracture. So different types of activities there. Now, certainly, let's talk about some of the side effects, because narcotic pain medications are not benign. I want to be very, very clear on that. These are dangerous medicines that should never be abused and should only be used under the close guidance and supervision of your physician. So first and foremost, constipation. All narcotic pain medications will cause some aspect of constipation. It slows GI motility and therefore can lead to significant constipation. A lot of these are morphine derivatives, and they can cause itching, nausea, and then of course the most dangerous and concerning one to us healthcare professionals, of course, is dependency, because patients often will have real pain. And physicians, we want to alleviate that pain. And so we may prescribe narcotic medications. And we try and do this in the most judicious way possible. We want to use the lowest effective dose for the shortest period of time. But sometimes patients will have dependency issues. And this is a real challenge. But certainly we want to try and minimize that. And if we do start seeing dependency issues, we want to start trying to taper and wean people off of these medications as soon as possible. So again, let's go and take a step back. So now we've talked about different types of this, but we want to really think about this as a multi-modal approach. We want to see that patients are using non-narcotic medications. We want to see patients that are using massage, heat, ice. We want to see people doing movement. We want to see people that are using Tylenol. We want to see people that are using ibuprofen sometimes. We want to see people that are sometimes having to partake in narcotic medications as well. But if we look at this as a overall overarching approach, we have much better effects. Unfortunately, too often, I have patients that are in pain, and because they're in pain, they often can be somewhat short-tempered, or they're frustrated because of that pain. And so they want the easy answer a lot of the time. And they want us to just continue to upwardly titrate the narcotic. And I understand that, and I have no problem doing that. And I think I speak for the vast majority of the medical professional when I say that we want to help people to alleviate their pain. But we also want them to do the hard work. We want them to do the massage. We want them to do the ice. We want them to do the rest. We want them to do all of the non-pharmacological therapies as well too. We can't just simply rely on narcotics and then upwardly titrate those narcotics all the time. We have to do a multi-modal approach. Maybe use the gabapentin and the Lyrica for the neuropathy pain, even though the patient may not feel that that provides them the same level of pain relief. So we want to be very judicious in our usage of these types of things. One thing that we didn't talk about before, but also to be considered, is that maybe even some of these patients need to go for nerve block therapies, right? So as a general practice provider and internal medicine provider, I don't do nerve blocks, but sometimes we can refer patients to pain management specialists in order to do long-acting nerve blocks as well, or epidural medicines and things of that nature. So again, let's talk a little bit more about risks. So addiction, dependency. It's very important that we educate patients about using the lowest effective dose of these medicines. And a lot of the time too, patients will think that, well, because ibuprofen or Tylenol is an over-the-counter medication, that they're not dangerous, but they are most assuredly very dangerous. People can end up getting liver toxicity. They can go into liver failure. They can end up having major problems associated with their livers if they take too much Tylenol. So Tylenol can be very dangerous and deadly, as a matter of fact. Ibuprofen can cause problems with GI bleeding. It can cause problems with kidney failure. So we have to be very judicious in these medicines. They are not benign just because we can buy them over the counter. Patients need to do some of the hard work, right? It's our culture a lot of the time focuses on how can I get the quick fix? How can I improve my quality of life immediately by taking a medicine? And I'm happy to oblige patients in regards to that from time to time, but we also have to make sure that we're doing the appropriate rest. We're giving them the appropriate heat and ice and trying other modalities in order to alleviate their pain. We have to look at their depression situation, right? Are they someone that is suffering from an emotional disturbance, an emotional pain component to this that is amplifying the physical pain that they're feeling? Sometimes we have them talk with specialists in order to help minimize those types of factors. Utilizing that multimodal approach is absolutely critical. And then, of course, maintaining appropriate bowel regimens and monitoring our stomach acids and our hemoglobins and our kidney function and liver function tests if we're taking a lot of Tylenol. And certainly never exceeding the recommended dosages that we're using. So again, that's going to kind of wrap us up for pain and palliation. And I hope that just tried to kind of scratch the surface of different types of pain medications. And of course, if you have any questions about pain management, please don't hesitate to leave those comments below. We're happy to try and respond to you. I really would like to hear what different types of pain strategies work for other patients and other healthcare professionals so that we can kind of grow together. But I'd really like to invite you all to join us next week on April 10th for Healthcare Directives, a combined medical and legal approach. I'm very excited. We're going to be doing this webinar with Paths Law Firm, where they're going to talk to us about these healthcare directives from a legal perspective, and then I'm going to chime in with some of my medical perspective as well too. So feel free to join us at our registration at www.wellspringhealthcare.org. We look forward to seeing you there. And of course, let's keep in touch with Ascend Hospice. If you have any issues or concerns, or you think that you're a patient that's suffering from pain and you have a chronic life-threatening illness, we would be happy to try and help take care of that, either on our palliative services or also on our hospice services at Ascend Hospice. And of course, keep in touch with us here at Wellspring Healthcare. You can reach out to us at our website, www.wellspringhealthcare.org. Reach out to our medical assistant, William, at 816-708-1661. And if you're a facility that's interested in partnering us, we are expanding across the Kansas City metro area. Please don't hesitate to reach out to Brandy at telephone number 816-708-1658. Thank you all for joining us so much, and we really appreciate the opportunity for you to stay with us to learn about pain management and pain control. We hope you learned something. Take care.